I'm going to talk a little bit today about how to help you manage your urinary incontinence. I've got a couple of products here. This is a pad, fairly straightforward. You put it into your pants and it has some level of absorbency. We also have a sheath. Good thing about a sheath is it's non-invasive. It's a bit like a condom, goes over the top of the penis, and we attach it to a leg bag or a night bag. And what it's doing is it's draining the urine away from your body, so it's keeping you dry. Unlike the pad, it's keeping the whole area dry, and it's helping to reduce the risk of getting pressure sores and getting dermatitis, getting sore in that area. So part of my role as a continence nurse, it would be to help you measure to have the right size of sheath. As you can see, we come in different widths and different lengths, and it's important that you have the right size sheath so it's going to work well for you. So the first thing I have here is a measuring guide. So I'll show you on the model I have here. If we went for this one, it would be slightly too big. If it's too big, it's going to come away. It's not going to work for you. But if you go too small, it's going to be uncomfortable. It's going to be tight, might be a bit restrictive. So for this particular model, I would go for a 28. You might notice as well, when you get your sheath, a product like this is what we call a hair guard. This goes over the top of the penis, like so. And if you have any hair, helps to keep the hair back. Another product I would use is a barrier wipe. A barrier wipe is good for keeping the area clean, but also it makes the area quite tacky. So when you're putting the sheath on, it helps to keep it nice and tight. So I'm going to put a little bit of this barrier film on first. When you get the sheath, you have a little part like this, which you can tear down. And when you get the sheath out, again, it looks a little bit like a condom. So it goes on the end of the penis like so. You grab the tip of the penis on the inside and it just rolls down really simply, and there's an adhesive inside there which just attaches itself to the penis, and because this is the right size, helps to keep it secure. So sheaths are incredibly tacky, so you're going to need a way of how to take this off. If you still have your hair guard on, to remove it, you just give it a little tear and it comes off nice and easily. You don't have to have this on the whole time. You could actually take this off as soon as you've put the sheath on, or you can keep it on the whole time. It's whatever you're comfortable with. So to help to take the sheath off, I would use a medical adhesive remover. Without using this, if you're taking them off every day, it's going to get quite sore because, as I mentioned, it's incredibly tacky. So a little bit of a spray of the adhesive remover, like so. And what that's doing is it's breaking down the glue. What I tend to do then is lift a little bit of the sheath and just spray in between the skin and the sheath. Helps to release the adhesive and it comes off nice and easily. Once it's off, you would just put this into your normal household waste.